Imagine having a condition that could be silently damaging your health right now, increasing your risk of heart disease, drastically shortening your lifespan, and even affecting your brain function. And it's a condition that affects up to 80% of overweight middle-aged men. What if I told you that as a GP in the UK, I can't actually order the test to look for it? It sounds crazy, right? But what I'm talking about is insulin resistance. And by the time most men find out they have it, they've basically got the end-stage disease, which is type 2 diabetes. But here's the thing. You don't actually really need a test to diagnose it. There are a few clues you can pick up on that are pretty strong indicators that you've got it. In the next few minutes, I'm going to show you exactly how to spot them so you can actually do something about it. Now, because you've clicked on a video that says insulin resistance in the title, there's a chance you might know what insulin resistance is. So bear with me while I quickly explain it for those who don't. Insulin resistance is when our bodies stop responding to the effects of insulin in a normal way. Our pancreas, the glands deep within our abdomen, have to produce more and more insulin in order to have the same effect on our cells. Insulin's the main signal to take up glucose from our bloodstream and take it into the cell to be used either for energy or stored as fat. So in someone with insulin resistance, that insulin is going to be around at much higher levels and for much longer than normal. So can we just check insulin levels several hours after a meal and see if they're raised? It makes sense, doesn't it? Here's the issue. Elevated insulin levels hours after eating can be a red flag, but at the 12-hour mark, insulin might look perfectly normal even when there's a problem. So we're left in a situation where a positive test result is useful to us, but a negative result, not so much, and it might even give false reassurance. You see, when we design screening programs for various illnesses like breast cancer, cervical cancer, we need to avoid two big pitfalls, and that is too many false positives and too many false negatives. Unfortunately, fasting insulin alone just doesn't cut it. There are a couple of more sophisticated tests worth mentioning, one of which is called HOMA-IR. It combines fasting glucose and insulin levels into a single calculation. It's much better than looking at insulin on its own, but it's still a snapshot, and sadly, it's not diagnostic. Think of it like trying to survey a house by only looking at it from the outside. Sure, you might spot some obvious issues, cracks or broken windows, but you'll miss hidden problems inside like faulty wiring or a leaking roof. The gold standard test is called the hyperinsulinemic euglycemic clamp. Fancy name and an impressive piece of science. Basically, we pump insulin into you, carefully adjust your glucose levels, and measure your response. It's brilliant, it's highly accurate, and it's widely used in research, but it's completely impractical for everyday use, like trying to do the school run in a Formula 1 car. Basically, we don't have a single, reliable, practical screening point for insulin resistance at this time. And this is very different from something like thyroid hormone levels, where we can run a straightforward blood test and get a reasonably accurate picture. But here's the thing. In the absence of perfect tests, we need to think more like detectives than traditional doctors. We need to put on our Sherlock Holmes deerstalker and look for some clues. Now, some of these clues are obvious. There are several conditions that practically scream, "You've got insulin resistance." It's like someone standing over a dead body with a bloody knife and saying, "I did it." But other signs are more subtle, like finding a partial fingerprint or a single thread coming from a piece of clothing. And that's what we're going to explore today. Those subtle signs, those clues that when pieced together paint a picture of insulin resistance. But in order to think like a detective, we've got to come from an initial starting point. We have to get suspicious. And this is why I say that if you're an overweight middle-aged man, you should be highly suspicious that insulin resistance is lurking there. It just gets more common the older and fatter we guys get. All right, I'm going to take the hat off now. You get the point. Let's start with what I call our smoking guns. These are the signs that, when you see them, are essentially diagnostic of insulin resistance. As I mentioned earlier, when you get diagnosed with type 2 diabetes, it's effectively diagnosis of severe insulin resistance. Your body's been producing more and more insulin, trying to control your blood glucose until eventually it just can't keep up anymore. We've missed the opportunity to catch it early. However, there is still hope. Have a look at these amazing photos of a viewer from this channel, Darren, who was diagnosed with diabetes 7 years before he started his journey. He's now half his original heaviest weight, his diabetes is in remission, and he's playing tennis 3 times a week. Now, I'm going to catch up with Darren in a few weeks, and I'm going to be making a video about his amazing transformation. So make sure you're subscribed to the channel. You don't want to miss that video when it comes out. But as incredible as Darren's transformation has been, we want to catch things as early as possible. The real opportunity lies in spotting prediabetes. Sure, by the time you're at this stage, you've already got established insulin resistance. It's not quite high enough to meet the threshold for type 2 diabetes yet, but it's still time to act. Yet all too often, this is simply dismissed as, let's keep an eye on that, or try and look after yourself a bit better. Maybe a few less takeaways. It is a huge missed opportunity to really stop things progressing. A second smoking gun is what we now call metabolic dysfunction associated fatty liver disease, or MAFLD. Some of you will better know it as non-alcoholic fatty liver disease, but the name has changed in 2020. Now, I have got a confession to make here. I completely misunderstood this condition, as so many doctors do. I'd see patients with fatty liver on their ultrasound scans, and I'd assume that they were hiding how much alcohol they were drinking. But here's what I now know, and why changing it to MAFLD was such a smart thing to do. See, MAFLD is essentially diagnostic of insulin resistance. I don't want to go too much into this in this video because it gets a little bit technical, but basically, when there's a significant amount of fat in the liver itself becomes insulin resistant. And it's incredibly common. About 25% of adults worldwide have it, and that number jumps up to over 75% in people carrying extra weight. The problem is, your liver function test can be completely normal, even with significant fatty liver disease. Sometimes we pick it up when we're scanning that general area looking for other things like gallstones. And many doctors will just note it on a scan and move on rather than actually address it. And address it we should, because in the words of diabetes expert Professor Roy Taylor, before diagnosis of type 2 diabetes, there is a long, silent scream from the liver. See, these two smoking guns, diabetes and fatty liver disease, they're like the end of the story. But as any good detective knows, there were always clues along the way. And that's exactly what we're going to look at next. The major clues that can help you spot insulin resistance long before it progresses to these more serious conditions. First major clue we need to look for is fat stored around the middle, what we call central obesity. Now, this isn't about how much you weigh overall. I've seen plenty of people with a normal BMI who have significant central obesity, and admittedly less commonly, others who weigh more but store their fat differently. Your body fat isn't just there sitting doing nothing. It's metabolically active, especially the fat around your organs, what we call visceral fat. And when you've got insulin resistance, your body preferentially stores fat in this area. Indeed, we're finally getting the idea that waist to height ratio is probably a far better indicator when it comes to assessing metabolic health than body mass index is. The simple test? Measure your waist at belly button level. If it's more than half your height, that's a major clue for insulin resistance. The next clue is blood pressure. Do you know what drives me crazy? When I see essential hypertension written in the medical notes. Now, essential is doctor speak for we don't know why. But here's the thing, we often do know why. Now, sure enough, some of it's just blood vessels hardening up a bit as we get older, but there's often more to it than that. High insulin levels cause your kidneys to hold on to sodium and water. More fluid volume means higher blood pressure. It sounds crazy, but I've had so many clients that have come off their blood pressure medications that they've been taking for years and years when we address their insulin resistance. Sometimes it happens in just a few weeks. And here's where it gets really interesting. Your cholesterol pattern can be one of the biggest clues, but most doctors are looking at the wrong numbers. For years, the medical profession has been completely obsessed with total cholesterol and LDL, the so-called bad cholesterol. But when it comes to insulin resistance, it's all about your triglycerides and your HDL. It's like we've been so focused on interviewing the obvious suspect, the real culprit's getting away. Here's what to look for. High triglycerides combined with a low HDL. That pattern is like a signature of insulin resistance. And statins, well, they don't fix this pattern because they're not addressing the underlying problem. So these three major clues, central obesity, blood pressure, and cholesterol patterns, they're like pieces of a puzzle. Each one on its own might not tell the whole story, but together, they're painting a pretty clear picture. But we're not done yet. There's some even more subtle signs that most doctors completely miss. That afternoon energy crash that you've been experiencing, the one you've written off as just getting older, working too hard, not getting enough sleep, that can be a really good clue. You see, when you've got insulin resistance, your energy levels can become like a roller coaster. After meals, especially carb-heavy ones, your body floods your system with insulin, trying to control your blood sugar. The result? About 2 or 3 hours later, you're fighting to keep your eyes open in that afternoon meeting. And I remember this vividly from my clinic days. Around 4 p.m, I'd be reaching for my third or fourth cup of coffee, and 1 or 2 or 5 biscuits to go with it. Here's what I've learned. When your energy is stable, you shouldn't need caffeine to get you through the afternoon. That crash isn't normal. It's not just about getting older. Now, final clue is something I completely missed in medical school. Your skin can actually tell us a lot about your insulin resistance. Now, insulin is a growth hormone, and your skin is your largest organ. Put those together and you've now got a visible window into your metabolic health. The signs can be subtle, skin tags around your neck or in your armpits, dark velvety patches in skin folds, what we call acanthosis nigricans, or persistent fungal infections. As a doctor, I used to mostly treat each of these as isolated skin conditions. Now I know they're often leaving us clues about what is happening with insulin. Think of these skin conditions like the canary in the coal mine. They're often the earliest visible signs that your insulin levels have been high for a while. And just like our other clues, most doctors either miss them completely or treat them as isolated problems. So now you know all the different signs that you need to look out for in order to be highly suspicious of insulin resistance. And so the next question is, well, what do I do about it? Well, you probably want to head over here to the next video to find out more.